Yeah. All right. So I'll tell you a little bit of history. This is actually kind of an interesting story. 65-year-old male got a CAC, sort of calcium score. And during that CAC, there was some concern for a mass. And so very incidental finding, and then a full coronary CTA was ordered. All right. So I want to change things up a little bit here. I was going to ask the first quarter of this group to sort of measure the aorta, measure the main pulmonary artery, give me a morphology of your left atrial appendage. Is it windsock? Is it, cauliflower? Is it a chicken wing? And then give me a number, how many pulmonary veins. And so these first two rows, why don't you guys start working on that? And I'll then have Tarek blurt out those numbers and we'll see if we have the same ones. The second half of the room, you guys are going to look into the coronaries, right? So this patient more likely than not is going to go into surgery. The question for you is, are the coronaries obstructive or non-obstructive? And would you recommend a left heart cath? And the group over here, you guys are going to focus on the mass. Find the mass. We know there's a mass in one of the atrias. Characterize it, shout out descriptions of it. I'll give you like 2 or 3 minutes to work on that. Tell me where it is, describe the borders, and measure it for me, okay? And I'll give you guys sort of 2 minutes. And Tarek will be going up and down the slides, the case, looking at all the things I asked for, and then we'll compare. You guys are going to measure the aorta, the main pulmonary artery, and tell me how many pulmonary veins there are. All right. So the first group, what measurements did you get for the ascending aorta? 40. Great. That's exactly what it was reported. 39 by 39. What's the main pulmonary artery? 27. And how many pulmonary veins? 2 on each side. Great. What's the appendage like? Windsock? Is it a windsock? I think you're right. Yes. It's kind of trying to be a chicken one, but but I'll take windsock. I love it. Okay, great. Good job. And the back room, what did you guys think about the coronaries? Is there any calcification at all? Yeah. What coronaries have disease? Okay, so mild. Okay. You guys agree? LED. What about RCA? About the same. Would you guys clear these coronaries and be like, you can go to surgery, no need for left heart cath? Yeah, great. Okay, good. And now this group over here, I may pick on you. Sorry.
Well, we thought it was, I guess, dark and regular shaped, with a narrow stalk. I would predominantly ovoid, I guess, round ovoid. It's adjacent to the left upper pulmonary vein, kind of attached to the Coumadin Ridge. I thought I did see kind of like a stalk attached to the Coumadin Ridge itself, like a narrow stalk.
19. That's exactly yeah, great. Yeah, that's exactly what we found. Okay, great. And so what would you be your first diagnosis if you had to guess what this was? Myxoma. Yeah, great job. And so that's exactly what that was. And here is a surgical picture of this exact same mass. Dr. Halkos was kind enough to provide this intraoperative myxoma picture of this exact case. This patient did not need a left heart cath prior to open heart surgery and is doing well. So great job.